All right. Welcome back to week 2 of the Recharge Fantasy Football Injury Report. Dr. Gene Shirakabrad.
Dr. Corey Howe.
All right. Well,
another week, another high-profile quarterback down.
Injury.
Yeah.
I mean, first of all, this was just an entirely crazy week of football. Me being a Ravens fan, I'm on the emotional injury report. I mean, it's still recovering.
Me being a Lions fan,
perpetual.
Somehow we're 1-1. That's like the best record they've had in 15 years.
That's like the Super Bowl for the Lions. 1-1 record.
You know, I'm
500.
surprised that, like, usually if the Lions win a game, it's like it is treated like the Super Bowl. People were pretty mellow this year. I think I think
our expectations up.
Yeah, expectations are up. Maybe they're hopeful to win 4 games this year. Who knows?
Let's not get carried away.
I know.
Let's not get carried away. Injuries have a way to derail a season, as we've seen. But yeah, couple fairly big quarterback injuries. One a season ender. 2 might be a season changer in a way.
Yeah.
So let's talk about the biggest one that was all over the news. Obviously,
Trey Lance.
Yeah. Yep. So similar-ish to Dak Prescott from a season ago. Not quite. He didn't have the full dislocation involved as well. But Trey Lance had a fracture of his lower leg, ankle region. Obviously, that is, by all accounts, a season ender. Even though, like we talked about last episode, when there's a fracture of that sort, which is a surgical repair situation, the healing time might still be within a football season, but the return to sport and the ability, the functional ability to perform at the level that Trey would need to perform at is nearly impossible.
Yeah, it's different than you or I coming back from a surgery like that. We'd be able to get back to work and that 12-week mark or something along those lines. But to be able to perform at a high level at the NFL level, that's a whole different story.
Yeah, it's an entirely different challenge. So Trey Lance is definitely either IR or cut at this point, unless you're in a keeper league or something like that. There's absolutely no reason for Trey Lance to take up a spot on your team at this point, which is unfortunate. You know, he was
a good athlete. Yeah, people had high hopes for him.
Yeah, but we were talking about this from a fantasy standpoint because I have Deebo Samuel on my team. I'm looking forward to what Garoppolo can do because they had really great repertoire last season, and he's more of a in the pocket passer, which I think opens up Deebo a lot more.
And actually, last week we talked about the running back injury with Elijah Moore.
Mm-hmm.
Moore?
Elijah something.
Actually, it's down here, right? Elijah Mitchell.
Yep.
Yeah, Elijah Mitchell. So I picked up Elijah Mitchell's backup running back, Jeff Wilson Jr. So, and that might actually, the injury to Trey Lance might negatively impact him if Jimmy Garoppolo is more of a passer. They might be throwing the ball around a little bit more. So it's funny how these things work out.
Yep. And similar situation to kind of what happened last year with Elijah Mitchell got injured and the running back that you have now stepped up. But Deebo's workload dramatically increased. So we're going to keep an eye on that as well. So Trey Lance out for the season. Another quarterback, though, that took a bunch of shots, and one in particular that injured his ribs was Justin Herbert. And I was watching that game, and he got absolutely destroyed a bunch of times, and he did a great job staying in there. But there was one sack where the defender, and I thought it should have been a penalty because he drove him to the ground.
Yeah.
But he rolled and landed on the defender's helmet, and the helmet was behind his rib cage, and there was a compression of the force into the helmet, and you could see the rib cage just collapse on itself. And he just stood up and he finished the game holding onto his ribs, but he has a rib injury. I don't think they fully classified it if it's a rib fracture or bruise. Regardless, if any of you have ever had a rib injury, it is slow healing and it lingers for a long, long time. And obviously an NFL quarterback, it's not like he gets to rest it.
Yeah.
They're always in danger.
Ribs are interesting. They attach I mean, most of them attach on the sternum on the front side, and then on the spine on the back side. And as a quarterback, especially, we need a lot of rotation for throwing the ball, and so it's almost like those ribs never get a rest.
What's challenging with quarterbacks and rib injuries is that aside from the contact that they have to endure, it's when, like you said, when you rotate and throw, you have to follow through and the ribs go with you. So a lot of times, well, not a lot of times, what you can see with quarterbacks when that rib issue is lingering is the overall accuracy goes down. Just the little passes, and he's a very accurate passer. Even in that game, he made some throws in the end that were pretty impressive with the injury. But the unknown that happens here from a fantasy standpoint is if he takes another hit, right? He'll get some kind of medication to deal with the pain before games. But if he takes any kind of significant hit, his mechanics will compensate, and we have no idea what will happen to his accuracy. So this is going to be most likely an entire season issue for him because, again, ribs don't heal up very quickly because they're attached to cartilage, and cartilage doesn't have really good blood flow and it doesn't regenerate.
Especially when you're getting hit every week.
Right. And, defenses know this. They're going to be going for him. So even the little things like a little push at the end, they might not sack him, but little things like that will add up.
The good news fantasy-wise is he didn't leave the game.
Yep.
He finished the game. So the odds of him being out next week is probably low, but it's just something to keep an eye on.
Yeah, I mean, you should have a backup if Herbert's your QB1. Definitely look for a backup quarterback because he can go out.
Maybe Jimmy Garoppolo. I think he's available in a lot of leagues.
Yeah, or Tua if you haven't picked him yet, but too soon. I don't want to talk about Tua. I don't want to talk about Tua.
Yeah,
not there yet.
Week 2 was labeled week Tua.
Too soon. Too soon.
I had him in my other league.
Let's move on. We did have another rib injury in week 2.
Yeah, and I think this individual did go out.
He did. He did go out.
Jerry Jeudy for the Broncos.
Yes.
He's a receiver, and rib injuries are tough with receivers.
Yeah.
I think some mental component goes into it. When you have to jump up and expose all of your ribs to catch a ball, that can be scary, even if it's subconscious. So I think maybe more so than the quarterback, rib injuries can be detrimental for wide receivers as well.
Yeah, or even just having the ability to extend fully when those ribs are hurting. You might not even get your arm up all the way.
Right.
And he was injured last season as well, so he hasn't had a full season yet to show what he can do. But he just landed awkwardly. It looked like when he came up, he just landed on the side and crunched down on his ribs. Reports so far are sounding like it's more of a bruise, not as serious as potentially Herbert. But again, similar story. Those injuries will linger for a little while, and you never know with receivers. So they're typically a little bit more hesitant and might keep them out a week or two to see how they're healing up.
There are some rib protectors that sometimes quarterbacks wear them too. But it's literally like a hard shell that you wear around your rib cage. So you might see him in that going forward too.
Yeah, I'm sure you'll see Herbert in something like that to give him a little protection. I'd be surprised if they put Jeudy in it because receivers want to be fluid and move around more. But something to keep an eye on. Again, he was probably a wide receiver 2 at best, flex going into it. I'd be surprised. I mean, it's a risky start even as a flex.
The Bronco offense hasn't looked that great yet.
No.
Even with acquisition of Russell Wilson.
No, they have not looked great. So unless you're really thin at flex, he should probably be a sit for a week or two. All right, let's talk about a knee injury at my Achilles heel position, the tight end. I have yet to nail down the solid tight end.
Yeah, tight end is like if you don't have Kelsey, Andrews, or Darren Waller, it's like those 3, and then way down here, everyone else. Even like the maybe the in-between people like George Kittle, he's been out since the start of the season too. So I don't know. Tight end is pretty shallow this year. Yeah.
And it's gotten even more shallow because of Dalton Schultz injury.
Yeah. Dalton Schultz is a tight end for the Cowboys. His ceiling took a hit when Dak Prescott got out last week. So they have Cowboys have a backup quarterback in Cooper Rush, who did pretty well. They won, right?
Yeah. Beat the Bengals.
Beat the Bengals. So all of the Ravens
AFC North teams lost.
Yep.
Thank God.
So I think that means the Lions are better than all of those teams because they won week 2. I think.
Sure.
Okay.
Sure.
Okay.
You take that win.
Yeah.
You take that win.
Dalton Schultz, what I read was PCL irritation, something along those lines. So a lot of people have probably heard of the ACL, the anterior cruciate ligament in the knee. We have a PCL as well. It's kind of the same thing, but the posterior cruciate ligament. Cruciate means cross. They kind of sit in there like this. ACL in the front, PCL in the back. ACL resists the tibia going forward. PCL resists it going back. They're not saying it's a tear. I don't think they necessarily anticipate him being out for a while, but it's interesting to note that a similar injury is what Ezekiel Elliott had last year, and he looked like a shell of a Zeke last year.
Yeah, because it's still unstable, and probably if you go back years back, maybe one of the most popular PCL injuries or well-known that happened was Mark Sanchez when he played for the Jets.
Butt fumble.
Yep.
Yeah. Okay. That's all I remember. Mark Sanchez.
That's what he's known for. Yeah. But usually you have those PCL injuries when you fall flat down on your knee. So you go straight down onto it, which doesn't happen surprisingly too often in football, but it does happen if you're kind of tackled awkwardly and you're trapped and you go straight down, which kind of looks like what he did. He just fell awkwardly. But you can play with a PCL injury. I think they're keeping a official diagnosis because it usually takes a week, several days for inflammation to go down before you can get a clear image of what's going on in there. So even if it's going to be a strain of some sort, 1, 2, or 3, like we talked about in the last episode, probably not a 3, but it's still the knee feels unstable. And usually when you have to break and before you do your cut, kind of what we talked about with receivers last week, when they have to break down and do a quick shift, directional shift, and it feels unstable, they lose that sharpness. And we know the level of competition, especially covering tight ends. If you don't have that sharpness, you're not going to do your cut, and you're going to be pretty much covered for your route. Yeah. So again, Dalton Schultz is probably a wait and see for another couple of weeks to see how he heals up. Even if it's a grade 1, we're looking at a couple weeks of recovery time.
The trouble is there's not many other tight end options, like we said. So you might have to ride out a hobbled Dalton Schultz for a couple weeks if that's all that's available to you.
Yeah. I mean, if they use him in the red zone as a red zone threat, that's something.
Yeah. If that's another thing to think about as far as fantasy goes, if somebody's snaps are limited, but they're limited to scoring opportunities, they can still score a lot of fantasy points.
Yeah. If he can't cut or have great speed, he could still be a red zone threat because he's a big body and has good hands.
Yep.
So we'll see what the official report is, but the next 2 weeks you should be very cautious with Dalton Schultz. But like Corey said, tight end is incredibly thin. My first week, my tight end scored 0 points. My second week, I had a huge upgrade of 1.1 points.
That's a big upgrade from 0. Upgrade. It's like infinite upgrade.
That's all the points.
Mathematically.
All the points. I did win my week, so I'm good.
Yep.
I'm good. All right, let's end with a couple concussions, which has been surprisingly in a good way, less concussions overall. 2 big ones were Hunter Renfro and Devin Duvernay. Devin, again, being a Ravens fan, he had an awesome start to the game with a 103.
Oh yeah, that was great.
Return.
That was cool. Yeah.
So that was him, and he's been actually a steady contributor for Lamar early in the season. He had 2 touchdowns week 1. Like, if you're wondering why are we talking about Devin Duvernay, because he became an emergent weapon for Lamar Jackson. Obviously, Bateman is a clear number 1. Andrews from a tight end standpoint.
That's like 1 and 1A.
Yeah,
Andrews
exactly
for Lamar.
Yeah. But Duvernay was coming up, so he'll probably miss a week and see how he does. Hunter Renfro is also for Carr, my starting QB.
So you have 2 things. You have David Carr or Derek Carr. I always mix that up. And you have Bateman.
Yep.
So Devin Duvernay going out helps Bateman.
Yep. Unless he gets more because he's the number one. So he's always going to draw the top corner.
Yep.
So if there's no other reasonable threat, then Bateman is going to be covered no matter what. So you can look at it a couple ways.
So then they pass the ball to Mark Andrews.
Or the other way. Mark Andrews across the coverage.
Yeah.
So, but Dobbins is looking to come back week 3. So if you have been sitting J.K. Dobbins, it looks like week 3 will be his debut for the 2022 season.
And 2021. Did he not play last year?
He did not play last year.
Yeah.
So he tore his ACL, but they've been surprisingly conservative with his return.
That's the best thing.
That is the best thing.
Yeah.
So
re-injury rates are so high in non-professional athletes. So I mean, imagine going back to that level of impact and cutting and activity in general.
Yeah.
So I think conservative is the best way to prolong somebody's career. I know it sucks as a fan when you want to get the athletes back, and then you have the crazy scenarios of like Adrian Peterson coming back in 6 months, which is unheard of.
And should not be heard of.
Yeah.
That's just not realistic.
Yeah. Concussions, though. Can you talk about what that looks like recovery wise? As far as I know, they go like week by week. There's a certain level of tests that they have to pass to be able to go back onto the field. Any other points with that?
So concussion recovery is interesting because it's still largely unknown. It is concussion has been really reclassified as a traumatic brain injury. So it is a brain injury, and like the brain, even though we know a lot, we still don't know a lot. So the best thing with concussions is post-test. It's less comparing it to standards and more comparing it to your progress. That's why when they go into their concussion protocol, they test the player, create a baseline of the testing, and then they progress and test again and again and again to see if there's objective progression from that initial test.
And I think they do the pre-test like before the season, right?
Yeah.
That's their baseline
as their physical.
I'm not saying this is true, but I've heard that some athletes do poorly on that first test on purpose. I'm not kidding. I've heard this, so that when they retest with the concussion, this sounds bad, they are closer to that baseline, so then they can return to play quicker. That is not very good advice.
That is
terrible. We're dealing with literal brain
CT,
injuries.
Yep.
So I'm not saying that really happens, but I have heard that, and that's a scary thing to think about.
Yeah. It's hard to fake, though. It is hard to fake once you're in that concussive stage. For anyone that's had a concussion, you can't make sense of anything.
Have you had a concussion?
I had a mild concussion. Yep. Long ago, but thankfully it was mild, and I didn't have any lingering symptoms. But it was not pleasant. So
I've never had one.
You want to grab a
maybe
PVC pipe or a bat or something? We can.
Without going into too much detail, I was in high school football. I dislocated my kneecap, but I was totally fine. I called my parents who were in the stands. They didn't know what happened. And it was just poor timing. At the same time, I called my parents to say, will you come get me? The loudspeaker called an ambulance to our side of the field because one of my teammates had a concussion. So they got a phone call. They also heard the ambulance. They literally ran across the field during, like, in between plays. Like the ref blew the whistle. My mom and dad ran across the field, and then the refs kind of like looked, and then my sister saw them run down, so then she ran across halfway through. It was kind of embarrassing, but
I feel like that should have been like a scene from The Waterboy, and somebody got tackled.
Basically, yeah.
Like your mom tackled the running back from the other team, and then kept going to you.
She'll hurt my baby.
But concussions are not funny.
Concussions are not
very
funny.
serious. Very serious issue. But yeah, concussions 1 to 3 weeks, depending on the issue. They've been, obviously, because NFL got so much heat from concussions over the last half a decade or so. They're very conservative and have fairly stringent protocols. So by the time a player is ready to come back, they're usually in pretty good shape. And I'd keep a close eye on Devin. I mean, he's sneaking up there to be almost a weekly flex play. If you're a little thin on flex players,
you get points in fantasy for kick return touchdowns. Yeah, that's a miscellaneous touchdown, right?
Yeah. Or defense, I think.
Sure.
So yeah, that's it. Week 2. All in all, aside from Trey Lance and maybe Herbert, I think a relatively light injury week. So that's good. That's pretty good.
Yeah.
So hopefully you guys are having a good fantasy season. I know we have at Recharge our 14 team.
Oh, I just got notified.
League.
My team defeated Team O'Neill 130-71.
Yep.
So shout out to Jim.
Yep, and I won last week against Ed. Pluto's not a planet.
Oh, yep.
We'll catch you again next week on the Recharge Injury Report.